Hi, I'm Colin Hung with Healthcare IT Today, and I'm excited to be sitting down with Malekeh Amini, who's the founder and CEO of Trayt Health. Welcome to the program.
Thank you for having me.
And Dr. Laurel Williams, who's the Medical Director for the Centralized Operational Hub of the Texas Child Mental Health Care Consortium.
You got it. It's nice to meet you here today.
Thank you for being here. Now, I'm excited because you just got off the stage here at Vibe, and you were talking about something that's very important. Of course, what we're talking about here is that we have a huge mental health crisis in the U.S.
Correct.
And there's been a lot of different ways to address this problem or attempt to address it. But in your talk, you spoke about this unique approach that you're taking in Texas.
Yep.
Can you share a little bit about that with our audience?
Absolutely. Yes. One of the things that's been so fantastic about what we're doing in Texas is we're actually working together. We have a consortium, it's called the Texas Child Mental Health Care Consortium, and it consists of the 12 departments of psychiatry across our big state, along with several important agencies like the Texas Education Agency, the Health and Human Services Agency, several nonprofits such as the Hogg Mental Health Foundation, as well as the Meadows Mental Health Policy Institute. And together, our team is charged with developing programs that will help all children in our state, regardless of where they are. So it's really fabulous. And I challenge you to find another state that's doing something as cool as Texas is doing.
And why is that your program, why has it been so successful?
I think that really honestly why it's being successful is you're getting people that are really dedicated and smart, and their mission is to help children. 1 in 4 children have a mental health disorder. We're all in it for the same reason, to help children and families get better. But we were all doing it in our own separate silos, right? And so when you have your own silos, you just start to have your own group think and what you're going to do for your team, yourself, those patients in front of you. But when we have to say we have a mission for the entire state, it allows for all the creativity across our programs to come together for that shared mission. So it's really about a shared goal that we have, even though we have so many different experts across so many different places.
I mean, it sounds like a challenge to bring everyone together on the same page.
Herding cats? Anybody?
But you've managed to do it, which is amazing.
It's been pretty fun. Yeah.
And it sounds like it's because you have that shared common goal that
Yes.
really helps drive everyone towards it.
Right. And so within the consortium, we have 5 different initiatives. The 2 that we've been speaking most today are about the Child Psychiatry Access Network, or CPAN, and the Texas Child Health Access Through Telemedicine, or TCHAT. So CPAN is a consultation program for primary care physicians in office, calling me, an expert, and get a call back within 30 minutes, so while the child's in office. And TCHAT is actually direct care. So it allows for us to help kids and families where they are. I sit at my place in Houston, Texas, but a lot of my families sometimes would drive up to 4 hours to see me for a 1-hour appointment. If they can do that with their parent legal guardian signing consent, having the child go down the hall, be in a secure, confidential room, have their parent come in to office virtually at their own workplace, It really just helps us give the care at the right time, the right place. And the goal is to get kids better and help families learn how they can help their kids. And so it's just so fabulous that we can do that across the state. So whether you're in Lubbock, you're in Corpus Christi, you're in El Paso, you're in Dallas, Texas, you're going to get the same service. It's fabulous.
Actually, that leads me to my next question. What technology is needed to support the work that's being done in Texas?
Great, thank you for the question. One of the things, so Trayt actually by background is a data collection, data analytics, and clinical workflow tool platform for behavioral health.
Okay.
It is patient-centered, so it follows the patient across the ecosystem of care, and it also is outcomes focused, and it really is concentrated on collecting the right data and synthesizing it in order for clinicians to have more informed, have the tools and the data that they need to make more informed decisions. So that is what Trayt is by definition.
Okay.
As Dr. Williams mentioned, the program needed a technology that would connect the entire ecosystem. And so we've done that. We've connected all of the primary care physicians into the public school systems, into the psychiatry clinics that are delivering the services on behalf of the programs. And we have also integrated all of the institutions that typically, again, don't work together and their systems are really separate from each other. But now they actually have the same platform, they support each other, and they provide services consistently across the state, regardless of where they're sitting. So if UT Houston doesn't have a psychiatrist one day, seamlessly this gets transitioned over to the Baylor College of Medicine for psychiatry support. And it's also, because it's an ecosystem platform, it's made it easy to transition across programs. So primary care physician, let's say a pediatrician has a pregnant teen at their office. They would contact CPAN for some support. So they will initially maybe get a call from the Texas Children's Hospital's child and adolescent therapist, and they provide some support and some resources for that 16-year-old pregnant teenager. But seamlessly, without the primary care even knowing it in the back end, then that call gets transferred over to a reproductive psychiatrist sitting at Baylor College of Medicine in order to do medication management for a pregnant woman. So it's made it really easy to deliver a consistent statewide program connecting all of the ecosystem.
And when you mentioned before, you were gathering information from the different stakeholders in the ecosystem. What kind of information are you gathering together in order to provide to the folks who are providing the care to these patients?
We're a state-funded program, so we obviously have multiple stakeholders. So to your point, data needs to be utilized in multiple different ways. One way is with that patient, the clinician, the family. That's one data point that we need to have data. And so talking about what is it that would be helpful to PCPs. So we actually need to ask those stakeholders, what would you find helpful information? And the same thing for families, what do you find helpful? What would be information that's helpful? That's one set of stakeholders. The other set is, of course, the state agencies. They want to know how we're doing so we can keep track of that. For example, we have over 10,000 providers in our CPAN network to date, and we're growing. Our goal is to enroll every primary care provider in the state of Texas, right? So we can sort of say, here's the primary care providers, here's where they're enrolled, here's how often they're calling, here's what they're calling about, here's what kind of help we provided them. So then on the back end, we can go back and say, hey, we're getting a lot of calls about how to help kids who are having an eating disorder. Well, let's create some educational content for people so they learn more about eating disorders, because part of CPAN's job is to help primary care providers do as much as they can in their own offices so they don't need to refer to a specialist. There's a shortage of mental health providers that we're not going to get ahead of for the next 20, 30 years. So we need to make sure, and I'm serious when I say the next 20, 30 years, we need to make sure that we can upskill everybody in the system to do their part and participate. And that's what CPAN does. TChat, same thing. We need to know how many schools are enrolled, what they're referring the child for, so we can help those children where they're located to make sure that we're providing equitable care, that we don't want to recreate inequities in our service delivery model. We're pleased to say at this point that we're really on point with the children that we're providing services for, match up very nicely with the demographics across the state. So we're constantly using that information to make sure that we're doing a good job. And then, of course, we have now over 500 independent school districts in Texas who've enrolled. There's about 1,500 to go potentially. And then we've have over 2,000 individual campuses where this is available to them, and about 2.5 million children that can have access to this state-funded service. So we want to know, what are we getting referred for? How long is the service? What service providers did they need help? And then also that issue of measurement-based care, not just did we see you, but are you getting better? At the end of the day, I'm a clinician. I actually want to help you get better. And if I can't know that I'm getting you better or not, that's not a win for the parent, for the child, or the state. So we actually are looking at that information as well. And we have some preliminary data that is looking promising that regardless of your age, race, or gender ethnicity, we're getting you better if you have moderate to severe depression. And that makes me feel better as a clinician at the end of the day, but it obviously will help all of our various stakeholders know that we're making and providing a high quality service.
So it sounds like your system, your platform is bringing all this data together in order to enable the clinicians and all the different folks to close this loop, both on the front end to know the assessment and on the tail end to know that they're getting better. Is that right?
Yeah, that's exactly right. So Trayt, by just as a foundation, is a measurement-based care platform in behavioral health. And it is providing the data and the tools that clinicians need in order to improve the care at every patient visit and to be able to assess patients accurately. In Texas, but also as a platform, we have streamlined that process. Currently, all the assessments are done on a set of questionnaires in behavioral health, and those are many times still on pen and paper and have not been streamlined. And so actually last week I was talking to a primary care physician and I asked her, where do you store the PHQ-9A information? And PHQ-9 is the measure for depression.
Okay.
So she just opened a drawer and said, I put them here. So she's collecting the data manually, scoring it manually, and then making a decision on that basis. And it makes it very difficult to track over time, obviously. And it has to be repeated over time. So that's one thing we've done. We have a large library of these standardized measures that we have automated in terms of data collection. So it's seamlessly sent out, receives the data through patient-facing applications and also secure connecting points from other types of ecosystem required entries.
Right.
And it scores them automatically, and it can even schedule them ahead of time to be resent for continued progress measures. And it also enables the program to measure progress over time. There are a couple of other things we've done. So for us, measurement-based care goes beyond just those. The actual questionnaire and the single visit between a clinician and a patient. When a patient is sitting in a clinic, they look different from what they are when they are at home,
Right.
or when they are at school, or when they are what they're telling their primary care physician, or even things they have in their own life that no one can observe. It's their own life experiences. There is a lot of evidence, and it's very important that that information is collected to enrich that conversation between the clinician and the patient at the time of visit. So it's not relying on that one data point. And it brings in a lot of information that is collected in between patient visits. So it gives a much better, much richer set of data to the clinician. Another component is, which is proprietary to Trayt, is really looking at behavioral health from a broader perspective. The symptoms in behavioral health are impacted by a number of other factors, medical conditions,
Sure.
life challenges. Those are all impacting behavioral symptoms. So the Trayt application collects over 750 different factors and is intelligent to synthesize that information, create connections between the medical symptoms, behavioral symptoms, life challenges, including social determinants of health, and then synthesize that information for clinicians and create a 360-degree view to help or to provide the clinicians with the tools they need to make a more informed diagnosis and treatment decision.
So how do we take what you've done in Texas and scale it so that more people can benefit from it?
Yeah, so one of the things that I think was really important about why Texas is being successful in this space has been that there was a collaboration from the outset. And in point of fact, even before I came in to be with the consortium, the department chairs had been meeting on their own separately every month to kind of talk about how can we work together. I think we just realized that all of healthcare is fragmented in the United States. This is not a unique situation for Texas, right? So if we can really talk about, let's get ourselves out of our silos and figure out where we can have commonalities. But the biggest nudge was around the legislation. So this is the other process I would say is like working with your legislation, because they were able to create the consortium, create the infrastructure for it, create the financial backing for it so that the teams could all come together for a shared and common purpose. So if other states or other organizations are looking to do something like this, it really is bringing all those stakeholders together, talking it through, and then really, particularly if you want to have something that's like a state sort of process, you obviously need the state to get engaged and involved with it. So that's been, to me, what's been really fabulous. Every single one of the teams that we have in Texas, the departments, the health agencies, they're all in it for the right reason. So it makes it fun to go to work every day because we all really have the same goal in mind.
Nice.
And that's really, you don't always have jobs like that, right? But when you do, you're like, this is great,
That's
right? So you have this shared mission.
Final question for both of you. What advice would you give to someone who's maybe listening or watching this, who really wants to start addressing the mental health issues in their community? What would you recommend to them on how they could get started?
It's actually interesting, the question. One of the things I would really be careful about is you get really excited about an idea and you start thinking, I'm going to create something. Well, the very first thing you actually should do is listen. Because if you go out into community, you're going to find that there's probably already people doing stuff in this space.
All right.
And maybe you know something in your hot stuff, but maybe your medium stuff. So if you can partner, then you make, it's like Transformers, right? You make it bigger and you make it better. So I actually would say one of the lessons I learned, I had to kind of learn more than once, that's why I'm kind of saying it, is go out and talk to people, because you're going to find that there's already people doing cool things. And so again, I can think of this kind of conversation when we first met. She was like, wanted to tell us about the platform, and I was not as interested because I thought we already had a solution to it, right? So using the 2 ears that you had versus the one mouth, I actually would say that it's that piece, because there's lots of people doing a lot of work in this area, and we could all amplify it if we work together.
Amazing.
Yeah, and actually, I also expand on that. I think there are a number of thought-leading, pioneering activities that are going on, but I think the statewide program in Texas is pioneering something that is really scaling and addressing the problem at a much larger scale. Talking to the experts, talking to those that have implemented this is going to be an important factor as well. And I think we saw during the pandemic how quickly agencies and private sector worked together to get a drug out and to get a vaccine out in 9 months in order to contain that emergency. We can see now, and we hear from the Surgeon General consistently, that the mental health crisis is the #1 public health issue in the United States. It is a crisis, it is an urgent need, and it would be great for the public agencies, the government, the private sector to really come together the way they did during the pandemic to address this issue as quickly and as broadly as they can in order to achieve similar results. They contained this pandemic in the way they did because of the collaboration and because of the fact that they really saw the urgency and implemented fast.
Absolutely.
Where can people go to find out more information about both your organizations?
Well, the Texas Child Mental Health Care Consortium is a mouthful, but if you write it down, and I Google it enough that it'll pop up in a Google search. So honestly, if you just do Texas Child Mental Health Care Consortium, you'll find us. So we have our landing page, and we talk about our 5 different initiatives. And if you're actually looking for a JOB, you want to come to Texas, we've got positions available across the state. So we're excited to partner with people.
Great. And we have, you can look at our website, Trayt.health, and there's a lot of information about what we do, and especially consistent with some of the work that we do in Texas. You can really find out more about how we can also enable some of the programs if you're interested. If anybody's interested to create similar programs, we're really happy to help.
That's Trayt, that's TRAYT.
.health. Yes,
Yeah.
yes, that's correct.
Well, thank you to both of you for being on our program today. I loved all the information you shared with me and educating me on this wonderful program you created in Texas.
Cool.
Thank you
so
so much. Thank you for having us.
We had fun.
This has been Colin Hung with Healthcare IT Today. Thanks for being here. And hey, if you enjoyed this interview as much as I enjoyed being part of it, we want you to go give us a review, rate, and subscribe wherever you're listening and watching this. Also, head on over to healthcareittoday.com for new resources and interesting insights. Again, I'm Colin Hung with Healthcare IT Today. Thanks for being here.